Did you know that brushing your teeth has a definite link to your immune system? How many of you knew that? Okay. Has a definite link to your immune system. Okay? In fact, during COVID-19, which is basically over, even though people still get cases of it, but the pandemic is over, those with advanced gum disease had the most severe cases of COVID-19. Were you aware of that?
No.
Well, that is the truth. Because oral health, that's your mouth, is closely connected to the health of the entire body. So when there's inflammation in your gums, you can be sure that there's inflammation in your gut and also other areas of the body. And is inflammation a good thing to have in your system?
No.
No, it is not. In fact, those that had gum disease and also COVID-19, and they got COVID-19, were 4 times more likely to be transferred into intensive care, were 5 times more likely to be put on a ventilator, and were 9 times more likely to die. So gum health is very important for your health. And so let me ask you this, what are gum disease symptoms? Does anybody know? Bleeding from your gums get red, swollen, or tender. Your mouth gets sore. You have bleeding while you're brushing or flossing or eating hard food. Your gums start receding. You have receding gums. Or maybe changes in the way your teeth fit together when biting. Something else that the dentist started seeing a whole lot more of was gum disease during COVID-19. Do you want to know why?
Why?
Because of the mask that people wore. Really? And they called it mask mouth conundrum. Wearing a mask, especially in confined spaces where germs may abound, can definitely impact the transmission of airborne bacteria. Anyways, while wearing a mask for a short period of time is harmless enough, but those who had to wear a mask for an extended period of time, there were some real problems, especially in the mouth. And some of the reasons why, what the mask caused, was shallower mouth breathing. Mask wearing tends to encourage mouth breathing. Did you notice that when you were wearing a mask? You started breathing more through your mouth instead of through your nose. This decreases the amount of saliva and it leads to dry mouth, which, if you have a dry mouth, that creates a perfect breeding ground for viruses and bacteria to grow, thereby increasing the risk of bad breath, tooth decay, and infections. It also caused dehydration. Why? Because people drank less water when they were wearing a mask. And dehydration also leads to dry mouth, which then creates the same thing, a ground for more bacteria to breed. And recycled air. When you were wearing a mask, you were breathing recycled air. And is recycled air good for you to breathe?
No.
Were we meant to breathe recycled air?
No.
What kind of air were we meant to breathe? Fresh air, not recycled air. So wearing a mask resulted in more carbon dioxide being trapped in the mouth than usual. And those slightly elevated carbon dioxide levels increased the acidity of the mouth's microbiome, raising the risk of gum disease and other inflammatory conditions. So when all of this started happening, dentists started seeing more patients with gum disease, and they labeled it mask mouth. And they're still dealing with that. Just something to think about. thankfully, we don't have to wear a mask nowadays, except for if you go into a hospital or you go into a doctor's office or something, and even in a lot of those, they're starting to do away with them there as well. I know where my son works up in Geisinger Hospital in Danville, and they know he no longer has to wear a mask, except if he goes in a patient's room and there is a patient in there. If there is no patient in there, he does not need to have a mask on, nor in the hallways of the hospital. So after 3 years of having to wear a mask working there, he was thankful when they were allowed to start taking them off. I don't think they've done that here yet in Wellspan. Anyways, here are some health challenges that are linked to gum disease. Think about this. Inflammatory bowel disease, kidney disease, liver cancer, obesity, osteoporosis, poor immune system function, preterm births, respiratory diseases, Alzheimer's disease, arthritis, anxiety, cirrhosis of the liver, colon cancer, depression, diabetes, gut cancer, heart disease, and hypertension. They're all linked to gum disease. That's scary. So what causes gum disease? Here are some things that cause gum disease. Poor nutrition. You're not eating a healthy diet. Failure to brush or floss your teeth. You know, there's more to taking care of your gums than just brushing your teeth. You need to floss them. Floss them, and a dentist will usually want you to use a water pick as well, at least once a day. Smoking, medications, female hormone changes, underlying immune deficiencies such as AIDS, heredity, stress, aging, defective fillings or bridges, and diabetes. So here are some quick tips. I've left out tons of information. If you really want this book and don't have it, we don't have any more right now, you'll need to come to dinner with a doctor and you'll get one free.
Amen.
Not in the beginning, at the end of the program. You are going to get a free meal. I promise you it'll be good and you'll enjoy it. And I think he said his lecture is about 45 minutes, so he's not going to be lecturing at you for 2 hours. I think you'll really enjoy it. Quick tips to improve your dental health. Making improvements in diet is one of the very best ways to fight gum disease and improve dental health. Some dietary choices feed bad bacteria. Examples such as sugar, junk foods, and processed foods, they will add to gum disease, while others feed the good, which would be a whole foods, plant-based diet. Moving your choices in the right direction is a major step towards improving mouth health. In addition to making healthier diet choices, you can also help the good guys' bacteria in your mouth by following the advice below. Don't smoke, and I'm sure none of you here do. Brush twice daily for 2 minutes. Floss twice daily.